Luna's sitting down here, so if I keep looking there, that's why. I did a poll on Instagram earlier this week, and the main, well, it was between doing a haul, which did really well last time, or whether you'd rather hear about how we're getting on with our infertility journey, and a little bit about my PCOS journey as well. September is Polycystic Ovarian Syndrome Awareness Month, or PCOS as most people know it as. Basically, PCOS is the syndrome which basically means that there's no kind of one rule fits everybody. Everybody kind of has their own experience with it. I mean, there's lots of different side effects that you can get from having it. Okay, so to be diagnosed with PCOS, you have to have 2 of the 3 symptoms that they look for. So if you ever went to your GP and said, okay, I've got this, I don't know what it is, which is basically what happened to me, but we'll go on to my story or how mine came about after. I just want to give you some information about PCOS to start with, so you can kind of relate or read that you've got it, or if you have got it or whatever. So the 3 main features of PCOS are irregular periods. So with irregular periods, under that bracket comes an ovulation, or when you don't ovulate regularly or every cycle. Excess of androgen, so that's the high levels of male hormones in your body, which can cause excess hair growth. And the other symptom, you've actually got cysts on your ovaries. So it says here, this is on the NHS website, polycystic ovaries, your ovaries become enlarged and contain fluid-filled sacs or follicles that surround the eggs, but despite the name, you do not actually have cysts. Oh. But despite the name, you might, you only have to have 2 of the 3. So you could have irregular periods and the hormone imbalance, but you might not actually have cysts on your ovaries, but you could still have polycystic ovarian syndrome. So it's quite a complex disorder, really. Those are the 3 things that if you went to the doctor that they will check for. There's no kind of one rule fits everybody, but if you've got 2 of the 3 of those, the chances are that you are going to have PCOS. It's gone really dark. I'm going to put my lights on. Is that any better? Those are the things that would come up if you, as how you would become diagnosed with PCOS. There's also some like symptoms and other things. So to expand upon the diagnosis point of view, how they'd go about that. Irregular or no periods at all. Excuse me. Let's try again. So, symptoms. If you have signs and symptoms of PCOS, they'll usually become apparent during your late teens and early 20s. So I got diagnosed last year, so it was just before my 26th birthday that I got diagnosed. So irregular periods or no periods at all, difficulty getting pregnant as a result of irregular ovulation or failure to ovulate, excessive hair growth, the word for it is hirsutism, usually on the face, chest, back or bum, apparently, says the NHS website. Weight gain, that's another thing, or it being like quite difficult to lose weight. Thinning of the hair and hair loss from the head, and you can suffer with oily skin or acne. Just on the plus side, another amazing side effect is that you have an increased risk of developing type 2 diabetes and high cholesterol. Yay, aren't we lucky? As far as I'm aware, there's no known causes of PCOS. Usually if your mom's got it, the likelihood is you will have it, but my mom or my grandma have not got it, and they, as far as they've known, they've never like struggled or been diagnosed with it or had any reason to be diagnosed with it. It's usually linked to high insulin levels. Many women with PCOS are resistant to the action of insulin in their bodies and produce higher levels of insulin to overcome this. This contributes to the increased production and activity hormones like testosterone. Being overweight or obese also increases the amounts of insulin in your body. Being overweight or obese also increases the amount of insulin your body produces. So with the insulin thing, when I first went to the hospital, they put me on metformin to try and help me lose weight and to regulate your hormone, your insulin levels. So you are insulin resistant. So I don't know the whole science behind it, so I'm only going to give you my lowdown of it and what I'm understanding to be true. Let's talk about my story, because that's like the best way I'm going to be able to talk through it, I think. So I first went to the doctors regarding my situation. We had started trying for a baby in the January, and I'd come off the pill and my periods just never returned. I've actually written a blog about this as well, so I will pop the link in the description below, but I haven't posted it live yet, so keep an eye out for that, because I might miss some details out on this and it might be better in Word format. So we started trying for a baby, no period, came off the pill, no periods. I also had really bizarre side effects. I mean, a couple of my friends had come off the pill for various reasons, like before I did, and they'd had no side effects. So I was like, oh, I'll come off and it'll be fine. So I was getting hot flushes, I was getting my skin and my hair all of a sudden got so greasy all the time. Like I could normally like go a couple of days without washing my hair. It got to the point when I first came off the pill, I had to wash my hair like every day, and I've not been like that since I was like in year 8, 9. So that was really strange side effect. I think it was just a combination of all the hormones. Usually the doctor can put you on the pill for PCOS, but it will just mask all your issues. So none of my symptoms had come to light because I was on the pill, and I'd not realised what was actually happening in my body. That's the thing when you're on synthetic hormones like the pill, you think you're helping yourself, but you can be masking a lot of issues, and if you are on it for a prolonged period of time, you might not realise what's happening in your own body. So I came off, greasy hair, greasy skin, majorly hot flushes. I can't remember what else. Oh yeah, my periods just didn't come back. So I went 6 months. Was it about 6 months? Yeah, I think it was about 6 months where I didn't have a period, maybe 5 months. And in that time I was like we were trying for, at the end of the day I wanted to have a baby, so I was like, I'm not ovulating, I've not got a period, so if I'm not having a period, I'm not going to be ovulating. And then they returned after like 4 or 5 months or whatever it was, and they were so irregular. They were really long. My periods were really long. I'm talking like 30 days plus. Then I think the first one was, so I was trying then, I was like, oh, at least if I've had a period I can kind of like gauge where I'm at, and I can try temping and using ovulation predictor kits and everything else to try and pick up ovulation. So I feel like I was in with a chance then. Nothing, no ovulation. That happened for 2 cycles, and by this point I was like getting a bit concerned. That was all over the place, and then I couldn't pick up ovulation. So we went to the GP. Prior to this I'd been searching on Google, and you get into like forums where people are like, wow, my doctor turned me away because I'd not been for 12 months, or you know, they pass the blame onto your period of your periods because you've not been off the pill for 12 months, and it can take 12 months for your body to regulate after you stop taking the pill, especially if you've been on it for as long as I had. But I've been on different contraceptions for the last 10 years prior to coming off. So I went to the doctor a bit reluctantly, worried about what she was going to say. And the lady that I did see, she was lovely, like really lovely doctor at my GP. But you know when you go to some doctors and they're like, well, our doctors is massive and you just get put with whoever. But I had seen her on a couple of other occasions and she'd never like wanted to treat the problem. She was a bit more of a holistic GP maybe, but yeah. Anyway, I went in, told her everything, said we were trying for a baby, whatever. And she basically said, right, it sounds like you might have polycystic ovarian syndrome. I'll send you for some bloods and for a scan. So she booked those in, which I was really grateful that I'd been in there. I went and had those done. This was probably in the September. Yes, because I had the scan after I come back from holiday and I got my blood results the day I was in the airport and I phoned them. And she said all normal. So in my head I was like, oh, okay. You know, sometimes they say come in, or sometimes they'll, if everything's clear, our doctors, they just say, yeah, everything's fine, you know, carry on. So that was all fine. So I went on holiday, I was like, oh, thank God, everything, you know, it's all right. It must be just the pill coming out of my system. So after that, I went on holiday as normal and I had the scan on my, the transvaginal ultrasound scan, my first one done in September when I got back from holiday. So I had that done and the lady, she was like, oh yeah. And I was like, oh God, what? She's like, yeah, you've got quite a lot of cysts on your ovaries. And I was like, no. Great. So at first I was quite confused because I didn't realise that you only needed to have 2 of the 3 on the list. I was like, but my hormones are fine, I don't understand, like how can I have that and not that kind of thing. Then I got sent back to the doctors after she did the report and stuff. So I went back to the doctors and she was like, yeah, I think you've got PCOS. We did one more blood test after that. It was a prolactin, I think. And I think my levels of prolactin were slightly high. And she was like, yeah, okay, I think you've got this, that and the other. You might need help along your fertility route now, but we'll order a semen sample for Mark anyway, just to make sure everything's all right there. Spoiler. That turned out to be terrible the first time, but we'll come back to that. I'm confused where I was at. Yeah, got the results from the scan, got the extra blood ordered, that came back slightly elevated. So the doctor was like, I don't think I can do anything more for you now. I will do a referral to the local hospital, to the gynecology department, and they'll be able to assist you further, kind of thing, as more of a special thing. A special words. A specialist department. We got sent there. This was the end of October, beginning of November. But by then, we'd had a letter come and it was to, go online and book an appointment or something. Or phone up for an appointment. And the next ones available were January, so that was this January just gone. But they managed to call me and said, we've got a cancellation for tomorrow, which actually ended up being my birthday. So we went into the hospital on my birthday and saw a consultant, which was really good. 2 months prior than what we were supposed to be seeing them. She was a nice lady. She did some different tests on me. She ordered more bloods. She did swabs while I was there. We both had our height and weight taken. That's when they told me to lose the weight in case I ever did need to have IVF, or put it out there that like I need to get my BMI below 30, which I've done. So that's all in order now. But yeah, on that appointment, she decided to put me on a drug. Well, I originally thought, it was just my ovulation, so they might put me on something called Clomid, which is an ovulation-inducing drug. But I didn't realise that they needed to do more tests before they'd give you that. They put me on a drug called metformin, which is it's a drug for diabetes. It's a insulin. Is it insulin? No, it's not insulin, it's the other one. Insulin sensitizer. We'll check. So it says here, besides lowering your glucose and insulin, so it helps to lower your insulin levels. Metformin may provide other health benefits to women with PCOS. Metformin can also enhance ovulation and regulate menstrual cycles. Metformin may even improve cholesterol, hirsutism symptoms. and acne and hair growth. They put me on the metformin to try and help with the insulin resistance that they thought I had because of the PCOS. But it just made me ill. Like, they put me on 1500 milligrams, so I had one in the morning, one at lunch, one at dinner, and I did that for, well, I did it almost instantly, and it instantly made me bad. I kind of tried to push through with them though, because I thought it was going to make me better, or help, and it just didn't. It just made me feel horrendous. They said it was going to help with the weight loss. They said it was going to help with my cycles, which it didn't for me. I mean, it might work for some people, but it just didn't help for me, which is when I started taking Infertility. So I'm going to be starting to take these again now, but I used to take them before. They come in little sachets, and basically it's a drug called myo-inositol, and inositol is already found in the body, so it's basically just helping, I think. So yeah, you take one in the morning and one at night, and you just mix it with a little cup of water, and basically that's supposed to do exactly the same as metformin, but without making you poorly. So I found those really useful before, but they're supposed to be really good for egg quality, and with us about to be starting IVF soon, that's why I'm going to start taking them again. I mean, they are specifically for people with PCOS, but again, it's Infertility for PCOS, Infertility for life. So yeah, I'm going to be taking them specifically for egg quality and to help with ovarian hyperstimulation syndrome and different stuff like that. So I'm going to be taking those throughout my IVF journey, just to give me the best chance, as a little bit of a boost. So I started taking those and I stopped taking the metformin because I heard that they basically did the same job, and these didn't make me poorly and those did. So I stopped taking those, started taking these, felt much better. Still no difference in my cycles, in my ovulation, still never picked up ovulation. And that's kind of where like my PCOS journey has kind of stayed put. My cycles are still a mess. My cycles are probably 50 to 60 days long now, and I probably bleed for a good 20 days, 15 to 20 days depending on the cycle, because nothing's linear in my life. Everything's, yeah, so it's hard to track, it's hard to pick up. I don't ovulate. Well, we for now found out that my tubes are blocked, and that's why I don't ovulate. For me, PCOS hasn't really changed my life too much. I always have struggled with my weight my entire life, and I didn't really know why it was so difficult for me to lose weight. And I think knowing now that PCOS makes it harder for people to lose weight, I'm kind of like,
oh, that makes sense now.
Yeah, that definitely helps knowing that there's a reason. But on the same scale, I've really upped the ante. I've now know what I needed to do to lose the weight and to keep it off. I mean, I've been losing weight now since January. We're in September now, and I've lost just over 3 stone, and I've managed so far to keep it off. So I like to think that I'm doing the right things. I've gone organic with my veggies and my fruit and stuff now. So again, that's only going to help. I do have a lower carb diet, because I've heard that is better for PCOS. I still have carbs, I still have bread, still have potatoes, still have rice, still have pasta, all of which in moderation and not very often. Obviously not all of them together, because that would be one big carb fest. There's somebody out there that would like that, Mark. but yeah, I do try and like be a bit mindful with my carbs, and that has helped. Yeah, so definitely being mindful with my carbs has helped me lose weight for sure. I'm not sure whether it's to do with the insulin resistance or whatever, but yeah, definitely that's helped. My other personal symptoms of PCOS that I get, other than my irregular periods and my struggle to lose weight, is I do get a few hairs on the chin, slightly darker moustache than a normal gal, but I am half Indian, so my hair has got the potential to be slightly darker. Although I am very fair naturally, I think it's the PCOS personally that I do get these bits here and these bits here. It's not anything major, it's not costing me, or it's not making me want to do anything about it just yet, but if it does bother me in the future, then I might look into different options, maybe laser or something like that. A more permanent solution than waxing or whatever, because that pain, I haven't got the patience for that pain. Yeah, so I've also noticed recently that my hair's starting to thin, but I don't know, it's because I keep tying it up like this, but yeah, who knows. So those are my kind of symptoms and my story of PCOS. If you've got any questions or anything regarding PCOS, drop me a message. Like, I'm happy to help. I've only been diagnosed for a year myself. I got diagnosed at nearly 26 years old, so it's all new to me still. I mean, if you've got any advice, if you've got anything that you take that helps you, these have been great. I mean, they're not cheap. Don't get me wrong, they are not cheap, but I did find that they've been quite useful for me. Quick update on our infertility stuff. There is no update. Infertility is long. You are waiting around a lot. So our funding for our IVF came through. I don't know if I told you that we need IVF. Went to the doctors in June, July, don't know, we're in September now. And basically she said, yeah, your tubes are blocked, there's nothing else I can do for you. She didn't offer me a laparoscopy, she didn't offer me anything with regards to like detangling them or figuring out the blockage. She didn't want to do that. I think it's because of the risk involved in the surgery like that. But she basically said, we're going to refer you for IVF and we send you to Birmingham Women's. So they did the form, we signed it all there and then. We've had all the tests done, so we were told that it wouldn't be too long with regards to getting within a month we would have heard about the funding being approved, which we have. Got funding for IVF, so we've got one round on the NHS. We're very, very, very grateful for, but we're now waiting for an appointment to come through. So we got our funding about a month ago, and now we're just waiting. As per usual, everyone in the infertility community knows how long you have to wait between appointments on the NHS, which is fine because we're all in the same boat together, but it is frustrating. So yeah, at the moment we're just waiting for our IVF appointment letter. I've also started reading this book. It's His and Her Survival Guide to IVF, and it's really good so far. I mean, for me, I think I'm going to do a whole other video on this because one of the first lines in here, Mark picked up on it when he read it. It basically says that you might be in the waiting room and you might think you've run out of time. I'm like, damn girl, I'm 26. No, like, I don't feel like I'm running out of time. Like, there's not enough about young infertility. Am I right, people? There's people out there like us, like me and Mark have been together nearly 12 years. Our anniversary's coming up, our 2-year wedding anniversary. There's people out there that are young that want to have a family. Not everybody waits till they're in their 30s or whatever, or, you know, I understand that a lot of people are going through infertility because they are a little bit older, or for whatever reason they've chosen to have children later in life, but there is a community of us youngsters, young whippersnappers out there that want to have a baby too, and we can't, but I feel like we're not represented too well at the moment. So here I am, trying to make a face for the young infertility community, because we all need someone fighting our corner. And I think if I can just talk about it and you can share it, and we can sort this together, you know. I think if I knew going into this that PCOS was a thing, if I knew that infertility can happen at any age and that it doesn't discriminate, like, I would have been so much more open-minded, whereas now I'm learning all this new stuff and I just want to talk about it because I want to help you, because it's not nice to be in the dark. One other thing to add about PCOS is that you don't have to be overweight to have PCOS. So there's another, I mean, you are at a higher risk of having it if you are overweight, or is it the other way around? Is it a vicious circle because you gain weight because you've got PCOS? Anyway, there is also the other version called lean PCOS. So you might not think you've got it because you're slim, but you can still get it if you are slim, and they just call it lean PCOS. So that's something to be mindful of too. And I think it shows the same. I think it's very similar. I know someone that's got lean PCOS and her periods are just as shit as mine, so good to know you're not alone. Yeah, I hope you liked this video. I hope it was informative. I hope that you can find some kind of similarities in your own story. Please, if you don't mind, like and subscribe. That would be absolutely amazing if you could. Feel free to share this video too if you've got PCOS, or if you want people to learn about PCOS. I mean, I'm just here in my bedroom talking to a camera, trying to help people understand. So feel free to share, because it's everyone's, you know, this can happen to anyone. It doesn't discriminate at all. If you have any questions, make sure you're following me on Instagram and DM me anything that you want to know, and I'll see you in the next